Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Dronedarone. Dronedarone is a new drug and this has a similar action to the amiodarone. But the main difference between amiodarone and dronedarone is it does not have iodine in the structure. Because it does not have iodine in the structure, it does not have the side effects of amiodarone. So this is actually the first drug which is used to reduce the mortality which is associated with atrial fibrillation patients. Atrial fibrillation patients mortality can be decreased by giving this dronedarone. Then um, so this has no thyroid because there is no iodine in the structure of dronedarone. There is no thyroid dysfunction in the dronedarone. The half life of dronedarone is also very small, very less. So the half life of dronedarone is very short, that is around 24 hours as compared to amiodarone.
thank you and thank you for watching.